People tell me they feel discarded, that their lives aren't valuable enough to get treatment. One constituent told me that their mother waited more than 110 days for radiation treatment with a hemorrhaging tumor, afraid to leave home because of obvious bleeding and odor from necrotic tissue. Nobody should live like this. We were warned that there would be an increase of more severe cancer patients coming out of COVID, but clearly no preparations were made. For 3.5 years under the UCP, healthcare workers in Alberta have been under intense pressure as they navigate the challenges of a healthcare crisis, the magnitude that we have never seen in our lifetimes. On top of the UCP's gross mismanagement of the pandemic, their caustic relationship with healthcare workers has driven many to leave Alberta, to change professions, or to retire. Alberta's healthcare staff have been pummeled by a lack of respect, a lack of support, and lack of resources from this UCP government. The casualties of the UCP war on doctors continues to mount as Albertans in need of potentially life-saving cancer treatment can only wait until their name reaches the top of a waiting list. They broke the system, and now, just before an election, they have nothing else to do but promise to give back a portion of what they took away. I'll now turn it over to Sheila.
Thank you, Marie. I'm here today because I am horrified by the wait times for cancer treatments for that Albertas are facing. My spouse, Brian, was diagnosed with advanced stage 4 lung cancer on January 26th. The diagnosis was very fast. He wasn't feeling well and went to emergency at the Sturgeon Hospital on January 25th and was diagnosed with lung cancer on the 26th. The X-ray and the CT scan revealed fluid in his lungs and a mass, and it appeared that the cancer was spreading. The physician in the ER indicated the Cross Cancer Institute would call within the next few days to discuss treatment. The first week of February, Brian received a call from the Cross suggesting oncologists will make rounds on Tuesday and he would be notified soon. When Brian was notified by the Cross, he was told his initial assessment will be March 23rd. Based on what we were told by 2 physicians, we were expecting treatment to begin around February 25th. We began investigating why the wait list is so long and when treatment will actually begin. We have been told by several staff members at the Cross that the wait time for patients is up to 8 weeks, sometimes 10. They have said that a staff shortage has resulted in a backlog, and it has been that way for a while. I called the Tom Baker Center in Calgary, and they are backlogged too. It's an 8 to 10 week wait for new patients there also. Brian has had all the required tests to help oncologists determine the best treatment options. Brian is in pain. He is short of breath, very weak and tired. He has had the fluid in his chest cavity drained twice, a liter each time, and may need to go again next week to have the fluid drained. Brian is also wanting to receive treatment that may save his life. Are they not giving him the treatment because they don't think he is going to survive? Or is it because of the backlog? Sadly, we know he is not the only one enduring this agonizing limbo of waiting for potentially life-saving treatment. Waiting is torture. It's absolute torture for Brian, for his family, for the people who love him. I am a nurse, and I have a background in pediatric oncology. I know how urgent it is to start treatment right away. The concern is, if the wait list is truly so long because of a staffing shortage, cancer doesn't wait for staff to be available. Cancer just does what it does. This is serious. This is life and death. If you don't treat people within a reasonable time frame, they die. It is unconscionable to have this long of a delay for people needing cancer treatment. I have never experienced this as a nurse or as a family member of anybody needing treatment. My son was diagnosed with leukemia when he was 2 years old, and treatment had began the night that he was diagnosed. Brian and his family are just living day by day in disbelief right now. How many other people are waiting the same unbearable situation? We are here to effect change. We cannot allow this to continue. Albertans deserve answers. This is not a political issue. It is a humanitarian issue. Something has to be done to get timely, potentially life-saving care for Brian and for other Albertans. Marie.
Thank you. Thank you, Sheila. It's heartbreaking to hear what your partner or what your spouse is going through, and the stress on your family must be overwhelming. I can't imagine. Albertans on a waiting list to receive potentially life-saving treatment deserve to know why they're on that waiting list. It's because is it because there's a staffing shortage, limbo, or what? It's unacceptable that people are diagnosed with potentially life-threatening illness and are waiting at home for months. If the answer is that there's no real treatment options, then the patient deserves to be told that. If the answer is a staffing shortage, that the UCP government must address that critical issue today. Lives depend on it. It is unacceptable that people are diagnosed with these types of diseases and then just wait in limbo. And this has been, a long time coming. This has been 3.5 years of cuts, of disrespect, of chaos and conflict in this healthcare system in Alberta. And we are starting to see, again, more serious results of that conflict and just ongoing disaster. And it's tragic that people like Sheila and her spouse have to be here today to share their story, to give Albertans an example of what's happening. So with that, we'll stop, and we're happy to take your questions.
Thank you. Just a reminder, if you're on Zoom, it's the raise hand function. If you're on the phone, it's *9 to get in the question queue, and we'll just see if there's any questions in the room.
Maybe I'll address you. What other options are available to you? You said you've reached out to Calgary hospitals. What are your plans?
I'm sorry, I didn't hear your question.
What are your plans if you can't get care here? Have you reached out to other areas?
Like I said,
provinces,
I've written some letters to people directly at the Cross, asking to receive answers. The physicians that we've met with already have indicated that he qualifies for treatment at the Cross. That we have to wait until maybe it's too late is not acceptable. We have explored other options of maybe going to the States, but of course that doesn't come without a price. And if we don't receive cancer treatment here, it would be nice if they would access some care or send Brian to another place that is offering treatment, either the Tom Baker Center or another province or to the States. Quite frankly, as a nurse, I can navigate the system. As someone who's dealing with Brian and seeing the changes and the struggles in his health, it's difficult to be an advocate, but also to rise every day and know that we need to support him the best. And I don't think it's up to the family to lobby or advocate for this. I think the care should be there.
Okay, we'll go to the phone line now. Michelle, your line is open.
What do you see as the or the NDP caucus see as the solution to this situation that Sheila and our partner are facing?
I'll defer that to Marie.
Thank you, Michelle. Well, I don't think there is one quick solution. I think it's an entire system in crisis that's been in conflict. And I think it begins with establishing a good relationship with healthcare workers, working with physicians and nurses and allied health professionals. I think people saw one of the plans that we rolled out about family health teams, creating 10 very quickly if we form government to start to relieve some of that pressure. But all of these things together, whether it's getting the Southwest Edmonton Hospital built, whether it's getting the X-ray machine working in Morinville that's been broken for 3 years, all of these things. It's investing in primary health care. It's making sure people have doctors. It's making sure our nurses and doctors are respected and are staying and feel respected and want to work here. It's all of these things that start to relieve pressure in all areas. And I think what we've seen is over 3.5 years of just nonstop cuts and chaos and conflict and pressure, not to mention a pandemic. And so we see the result here today, which is tragic, and we should not be here. So it is, I think that what this problem really needs is a stable, mature, focused government, focused on Albertans, focused on making the right investments in the right places, and that's what we intend to do should we form government in May.
Do you have a follow-up, Michelle?
Yeah, I do. But Marie, I mean, what you're talking about is primary care, and Brian's situation is well beyond primary care. He needs a cancer specialist. So what is the solution in that case? Like what should be done to help Brian and others like him?
Well, in Brian's case, he very specifically needs to see someone immediately. And so what I'm talking about are more long-term answers. In terms of Brian, he needs to be seen by an oncologist, by a cancer specialist as soon as possible. We're doing everything we can to advocate. I think one of the things that Sheila wanted to have done was wanted to speak to the public and speak to the media and say this is a problem. I've never seen anything like this in almost 8 years. The cluster of communication that I've received from desperate families looking for care, cancer care, after a diagnosis. And so we did our part just to try to get this information out there, to say to the UCP government, cancer treatment is a problem right now. People are not getting the treatment in a timely fashion that they need. We know that staff are stressed, physicians, nurses, all of the allied health professionals, and so they need to make some immediate investments so people like Brian can get the care he needs as soon as possible.
Thank you. We'll just do another pass for questions. Reminder, if you're on Zoom, it's the raise hand function. If you're on the phone, it's *9. Good in the room. Seeing none, that ends our press conference for... Oh, hold on. Oh. I don't know. Michelle, do you have another question?
Yes, I do. Just one more question for Marie. I mean, how many people are you hearing from that are in a similar situation to what Brian and Sheila are experiencing right now?
Since late December 6th, and
Okay.
and like acute crisis. Yeah.
Okay, thank you.
Okay, thank you, everyone. That ends our press conference for today.
For watching, and to learn more, check out albertasfuture.ca.